Hey everyone, this is Dr. Dune from Greeley Dental Care. So you've decided to get into a full arch of teeth supported by implants. Some people call it an all-on-4, some people call it an all-on-X, people call it teeth in a day, but essentially it's implants with a full arch of teeth and it never comes out. It can only be professionally removed here in the dental setting for cleanings and other things. It's as close as we can get most people to simulating natural teeth when you're in a position where the natural teeth had to be removed for any various reasons. What does that procedure look like? Typically speaking, in most people's offices with the technology and things we have, like for example here, we have a full-on lab where we do everything in-house and control all the variables. We have 3D printers and mills and different units that will actually create the stuff here. Most of the time, the way this will work is you'll come in, there'll usually be a form of sedation where you get to be asleep for the procedure. All the teeth come out, all the implants go in, any type of bone grafting is done, any type of infection is removed, all the stitches and surgical procedures are all done in one sitting, and then you can stay that day, or most people elect to come back the next day to have their long-term temporary teeth put in. And so the temporary teeth, they take about 3 hours to make after the surgery. So if we have patients who are coming in from like 10 hours away and they need to go home immediately for various reasons, we'll have them hang out here for 3 hours and then the teeth are ready and they actually will just screw in and they're permanently fixed in place that same day. For most patients, if you're within a driving radius or you can get a hotel over the night, what we recommend is go home, get some rest, let your body just recover, come back the next afternoon, all the teeth are ready, we place them in, and we get to check things when you're not numb. It's a little bit more predictable of a way to do it the very next day. Now consider it this way, those teeth are your temporary teeth. They are long-term temporary teeth, but they are temporary nonetheless. They're a resin tooth versus your finals, which are going to be zirconia, which are very strong porcelain. They could theoretically be as strong as metal, and you can just eat anything you want to eat on them. But when you're in your temporaries, you can't eat everything you want to eat. The rules are if you can cut it with a plastic fork, you can eat it. So that's like overcooked pasta, fish, scrambled eggs, things in that consistency. Go ahead and eat those things because we want you having nutritious foods. But if you go into breads and baguettes and things like that, you're going to break your teeth, or the teeth will get a little bit loose. So the reason why that happens is the teeth are resin teeth, like I said. You have a metal implant and a metal screw. So every time you bite into the resin, it just flexes a little bit and starts to loosen up the screws. If you loosen up the screws too much because you've been putting too much mileage on it and you're kind of challenging the teeth will get loose and then they break, or you can damage the parts of the implants that you're healing in. When you get into your finals, it's different because it's a metal implant. It's porcelain that's as strong as metal and a metal screw, and they just tie down way better. So then you might only need it retightened once every 2 or 3 years. So it's a huge difference in the experience from your temporaries to your finals. And I know right off the bat, you've been waiting so long for this moment. Now you can eat all these foods and you want to try, but all that's going to mean is you're going to break teeth and you'll have to give us a call. We'll have to reprint them out and you just have to see us more often, or we might have complications that we have to go then and fix. So in general, you come in for the procedure, all the heavy lifting is done on one day, and we try to do that to be as respectful of your time as possible, but also we want you to only be sedated once. We want you to be on antibiotics once. We want you to be on pain meds once. We want you to just have your body heal one time for this and not have to revisit this for a really long time. And now we actually have the technology to do that and do that very fast. 10 years ago when I was doing this procedure, I used to take 10 hours to do a full upper and lower, and I mean just way too long. Now we're looking at about 3 hours, start to finish, to do these procedures, and it's just the technological curve has allowed us to do different things. Also in this office, we've pioneered a few different techniques that we like to do that's made it more efficient, and then also having the lab here on site has allowed us to just treat more patients and control the variables and really keep the standards up to where we want them. So if you have any questions about the procedure or want really specific answers to your case, reach out to us at Greeley Dental Care. What I found through the years, because I've been doing this procedure for so long and all I really do for the practice now is surgery and more complex procedures, is some patients who have been told that they need a full arch of teeth and this type of procedure actually have a couple of other options maybe to save teeth. And maybe that's not the option you want, but my job is to make sure you at least know all your options. And then other people who have been told that they don't qualify for the procedure, and that actually happens more often than you think. Now with the new techniques that we have that we actually teach out of this place as well, we're rarely telling someone that they don't have enough bone for this procedure. So if you've ever been told that you don't qualify for any reason, I want you to reach out to us because things have got better than they've ever been. We just want you to make sure that when you choose a dentist to take you through this journey, and it will be a journey, it's not like you do the procedure and then you're done. You're going to do the procedure, and then you're going to have post-op visits, and then you're going to have follow-up x-rays, and then you're going to get new teeth, and you're going to check the cosmetics, and then you're going to approve the finals. This thing could take 6 months from start to finish to get everything dialed in. Now keep in mind you have teeth the entire time, but it could still take a long time to do this well and do this right. Make sure you pick a place you're really comfortable with and that they know what they're doing and they have the resources behind them to provide you with the level of care that you're looking for.